recording has been, now it's going. Thank you, Rebecca. We also want to make sure not only that you are aware that it's being recorded, but we also want to make sure that you know that you can turn on closed captioning on your own Zoom screen if you or someone else would like to follow the conversation that way. And first off, I want to introduce the speakers on our call today that were on that next slide. I think Rebecca just hit the button on there. Thank you. We'll start out here. They're in alphabetical order on the slide here. We are, I should say. First off, my colleague Maricela Garcia. She'll start us off today. She's the Race Equity Director for Advocacy here on our staff. And she's, and one of the issues that she works on is hunger policy. And again, I'm Laura Kellums. I'm the Northwest Arkansas Director here on the Advocate staff, and I'm joining you from Fayetteville today. We're also joined by Tamiko Townley. She's the Advocacy Director for our partners at the Arkansas Hunger Relief Alliance. And last but not least is my colleague who you just heard me referring to, Rebecca Zimmerman. She's our Community Engagement Director here at Arkansas Advocates. Before I turn it over to my colleagues, I want to briefly share how our meeting will go today. First, we'll have an overview of federal hunger policy, which will be the bulk of our discussion today. We'll have a short break after that, and then we'll talk about the legislative process and some tips on advocacy and lobbying. And between each of those discussions, we should have time to answer some questions. And you can put those in the chat at any time, and we'll watch for those. Or during that question time in between those sessions, you can unmute yourself to ask a question as well if you'd rather do it that way. So with that, I'll turn it over to my colleague Maricela Garcia to start our discussion today. Thanks again for everyone for being here.
Thank you, Laura. So today, Tamiko and I are going to cover the major hunger policies at the federal level, which include the CNR, the Child Nutrition Reauthorization, and SNAP, which is part of the Farm Bill. Next slide. So the Child Nutrition and WIC Reauthorization Act, or the CNR, includes almost all of the programs that fund food for children, except for SNAP, which is part of the Farm Bill, as I said, and Tamiko's going to talk about that in a little bit. So this is the major allocation for federal school meals and most child nutrition programs. The CNR itself is the process of making changes to the permanent statutes that authorize the child nutrition programs, as well as the special supplemental nutrition program for women, infants, and children, otherwise known as WIC, and some other smaller related programs. Although most programs are permanently authorized in the law, every 5 years, Congress has the opportunity to improve the laws governing these programs through this reauthorization process. Next slide. So the CNR is really important because it has this opportunity to adjust to the changing needs of nutrition for children. Each bill will have a different name. The current bill that we're working under is the Healthy Hunger-Free Kids Act of 2010. And unfortunately, that expired on September 30th, 2015, because Congress failed to act to improve these fundamental programs for child hunger. Changes to the CNR that amend two major statutes, the Richard B. Russell National School Act, which was signed by President Truman in 1946, and that created the National School Lunch Program, or what we know as free school lunch. Also the Child Nutrition Act of 1966, which was signed by President Lyndon Johnson, and that established the school breakfast program. Later changes to the laws added additional programs, and we will be talking about some of those in a little bit. It also modified budgetary provisions, which allow for many of these programs to continue. Like I said, even though Congress did not reauthorize the bill in 2015, they passed budgetary amendments every year that allow these permanent programs to be funded. However, some of the pilot programs and temporary activities have expired. The 2010 bill did some really important things. It expanded the availability of nutritious meals to more children in schools, as well as in after-school summer programs and in childcare. And it improved the quality of nutritious meals served in schools and preschool, as well as simplified the application process for parents. The programs that benefit, or the programs that fall under the CNR, benefit millions of children, in particular those who are low income. And it also allows schools, after schools, summer programs, and childcare providers to provide nutritious food for hungry children, who those programs then do not have to spend program funds on those meals. We know that food insecurity has grown through the pandemic. Unfortunately, due to the pandemic and the nature of data collection during this time, we don't have the best data on exactly how much. But the Pulse survey, which is done by the census, shows that Black, Indigenous, and people of color, or BIPOC people, are affected disproportionately by hunger. And that is at the national level as well as in Arkansas. In Arkansas, the greatest population of children facing hunger are white children. In absolute numbers, it's 45,000 children. However, if we look at the height of the pandemic last summer, as a percentage of population, roughly 11% of white children experienced food insecurity, while 24% of Black children and 23% of brown children did. So more than double. This data is incomplete, as I said, but we have seen these trends continue over time. And these disparities among races exist, even when you factor out other socioeconomic and other issues. So you can see that there are significant barriers BIPOC children and families face when they are trying to assess these necessary services. Next slide. So the school breakfast program and the national school lunch program, as I said, those were the two major bills first passed. And these two programs are typically known as free and reduced school meals. All children are eligible to participate in these programs, but low-income children are certified to receive either free or reduced price meals depending on the income of their parents. Together, these programs represent $14 billion in federal funding for child nutrition, and nationwide, 21 million lunches and 11.5 million breakfasts are served on average daily. We do not have in Arkansas a specific breakdown of breakfast versus lunch, but we do know that in 2019, which is the most recent year for which we have data, 310,915 children in the state receive free or reduced lunch and or breakfast. So the major issue with these two programs is that we know that the breakfast program is underutilized nationwide. A little more than 50% of the children who participate in the lunch program participate in the breakfast program. And the major recommendations for policy changes, the first and most important thing Congress could do is allow all schools to provide meals free to all children. This is really important because one of the reasons that children don't participate in the free and reduced meals program at the level that they should is because of the stigma. And this would reduce stigma because all children receive free meals regardless of the income level of their parents. In addition, it would reduce the administrative burden on schools and increase participation so more students who need the benefit can actually receive it. And students who are hungry have more deficits in academic achievement, health, and behavior. And so these would be improved by increasing participation in these programs. Secondarily to that, they should invest in community eligibility to increase the amount of schools, schools receive per meal. Community eligibility reduces administrative costs, it increases participation, and in addition, this allows more high poverty schools to be offered children free meals. Community eligibility allows the school to be certified and fill out the application, as opposed to each family having to fill out an application. So once they reach a set poverty level, that allows that school to be eligible to serve free meals to all students. And that increases the access of the program for the people who need it the most. They can also increase the number of low-income children who are directly certified without an application by allowing children who receive other benefits such as Medicaid, SSI, or if they're in foster care to qualify automatically. Again, this is going to require some cooperation between different departments to share information. Another option is to allow children up to 185% of the poverty guidelines to receive free meals. This is really important because currently that rate is set at only 130% of the poverty guidelines. For a family of 3, that's about $2,353 per month or $28,200 per year. That's a very low amount. If they make more than that, they do not qualify. At 185%, that would increase that amount to $40,626 per month or $40,626 per year or $3,386 per month. Another option would allow school districts to retroactively claim and receive reimbursements for meals provided to low-income children who certify later in the year. Many parents fail to certify in the initial period that they're given, which is generally they have to fill out the certification form before October 1st. And if they fail to certify, the school will not get reimbursement for those children, even if they fill out the paperwork later and they actually qualified. This would allow the district to overcome unpaid school meals by those families who are actually eligible for the benefit and who were receiving these quality meals. An additional issue is that charter schools need to increase their participation in school meals, as well as the after school and summer meal programs. Many charter schools, especially in the state of Arkansas, are located in very low income areas and target low income children. But those children are not receiving the benefit that they would otherwise receive if they were in public school of having free and reduced meals. And finally, in this area, we want to protect nutrition standards for all the food provided and sold in school. Healthy school meals and eliminating unhealthy competitive foods being sold plays an important role in developing the health of low-income children. Next slide. So the Special Supplemental Nutrition Program for Women, Infants, and Children, as I said, this program is commonly referred to as WIC. It provides nutritious foods, education, access to healthcare for low-income pregnant women, new mothers, infants, and children up to age 5. WIC also includes food packages that in Arkansas have several of the following foods depending on age: cereal, whole grains, eggs, milk or soy alternatives, cheese, yogurt, fruit, vegetables, etc. WIC has faced significant challenges in the past 10 years. There has been a significant decline in participation nationwide and in the state, and even further during the pandemic, which is somewhat hard to understand because especially Arkansas saw the sharpest decline in WIC participation from February 2020 through February 2021, 21% decrease in participation in WIC. At the same time, Medicaid participation increased by 11% and SNAP by 3%. If you are eligible for Medicaid and SNAP, you are similarly eligible for WIC. So while we don't know all of the reasons why these decline is happening, part of the problem is that WIC normally functions in a way that requires parents to go to the WIC office and be registered in person. And that was not an option during the pandemic. So many people possibly fell off the rolls because of that. So the primary recommendation here is to make permanent the flexibilities that were implemented due to the pandemic that allowed waivers and of the in-person requirement. So there was remote enrollment that allowed people to enroll online or by phone, and also receive remote benefit issuance without having to go into the office, as well as complete their education appointments from a convenient location over the phone, as opposed to having to be in person in the office. This is really important for working parents who maybe can't get off during the office hours to be able to go in for the classes that are required. In addition, we need to fund comprehensive WIC outreach and coordination. This would be patterned off the successful SNAP outreach program, which is to help community partners that where people are already receiving services, receive funding to do outreach and application assistance. People are already receiving services in those areas. They may be receiving appropriate language services in those areas. For example, the two biggest populations in Arkansas are Latino and Marshallese people, and to receive services in their language, to receive services in their primary language is really important for them to understand the application and the process. In addition, we need to coordinate data again. This is another area where coordination of data between healthcare and the WIC systems is important, so that instead of having to visit the office to be weighed and get your height measured, that data from your child's doctor can be automatically shared. We should extend the WIC certification period to 2 years and extend the age of children up to 6. Again, this helps support the health and wealth of the family itself, because it allows them to build more time with healthy foods and sustainable food security, and will help them transition off of WIC in a much easier way. In addition, we want to increase the WIC food package to be consistent with the current dietary guidelines for Americans. This is really important because right now we're using 2007 guidelines, which are fairly old. And this would increase the values of fruit and vegetable benefits and invest significantly more in the children's packages. Next slide. Other programs in the CNR, there's the Child and Adult Care Food Program, which reimburses child care centers, Head Start programs, family child care homes, homeless shelters, and after-school programs for snacks and meals that are served to children. In 2020, 4 million children received 1.5 billion healthy meals and snacks through this program. Included in this program is the after-school meal program. In addition, there's the summer food service program. This helps ensure that children who depend on school lunch and breakfast during the school year still have access to free nutritious meals and snacks during the summer. In July of 2019, 2.18 million low-income children received summer meals on an average day. There's also the WIC Farmers Market. The WIC office can issue vouchers which can be used to purchase fresh, locally grown fruits and vegetables at participating farmers markets. In 2019, 1.6 million WIC participants, or roughly 25% of all WIC participants, receive benefits through this program. There's the Fresh Fruit and Vegetable Program, which provides fresh fruit and vegetable snacks to children during the school day. This is for elementary schools that have 50% of the students that are eligible for free and reduced meals. And there's the Special Milk Program that provides milk to schools and childcare institutions that do not participate in any other nutrition programs. So in this area, within these smaller programs, we have two major groups of priorities. There's the out of school time priorities, which is after school and summer programs. And then we have the early childhood priorities. So in terms of out of school, the major issue is that summer and after school programs play a critical role to make sure that children aren't hungry after school, during holidays, and on summer vacation. They bridge the gap by providing these nutritious snacks and meals and draw children into educational and enrichment activities that keep them safe while their parents are working. Summer and after school programs will eventually play a critical role in helping children recover from the educational impact of the pandemic. However, out of school opportunities were severely limited even prior to the pandemic. Only 1.4 million children received an after school meal on an average day, and only 2.8 million children received a summer lunch on an average day in 2019. That's roughly 7% after school meals, and 14% of summer meals of the average amount of students that received a school meal on an average school day. So that is a very low participation rate, not because they're not participating in the programs, but because there are not enough programs for the children to be in. Recommendations in this area include to improve the area eligibility tests to allow summer and after school meal sites to participate if 40% of the area children are eligible for free or reduced meals. This is important because this aligns with other standards in programs such as the 21st Century Community Learning Center program. We shouldn't have different eligibility criteria in these areas. We need to allow schools, local government, private nonprofits to feed children year-round seamlessly using the summer food program and the child care and adult food care program. Right now, if you're a summer food provider, you have to apply through the summer food program. And if you're an after-school provider as well, you also have to apply through the child and adult care program. This is duplicative work, and these are generally the same children receiving services. So accessing the ability to apply one time and provide meals year-round is very important. In addition, we should allow summer meal sites to serve a third meal. Most summer programs run all day, but currently they're only allowed to serve 2 meals, which reduces children's access to quality nutrition. And we should provide funding for summer transportation grants to fund things like mobile meal trucks. Where children can't get to areas, we should bring the food to them. In the early childhood and preschool area, the major issue here is that the child and adult care food program provides the meals and snacks at health, as I said, at Head Start, child care, family child care homes, and after school programs. But under the current rules, meals and snacks are not available to many low-income children who participate in these types of programs. So recommendations in this area include, again, allowing a return to the previous additional meal that was allowed. Child care centers previously could provide up to 4 meal services, which is usually 2 meals and 2 snacks, but Congress eliminated 1 meal to save money. This harms young children whose studies have shown need to eat small, healthy meals and snacks throughout the day. Again, we need to streamline program requirements, reduce paperwork, maximize technology to improve program access, allow electronic data collection, and eliminate things like normal days and hours, and allow direct certification in all states, which would allow local education and states to certify the eligibility without the need for individual family applications. We also need to make permanent the pandemic waiver, which eliminates the area of eligibility tests to streamline access, and increase the amount for reimbursement. Cost is a huge barrier to providing healthy meals. To support the inclusion of needed fruits and vegetables, whole grains, lowered fat dairy products for young children, it's essential to their development at the time when it's most beneficial and will have the long-lasting effects. Next slide. So summer and pandemic EBT is one of the solutions that we think is particularly helpful. The pandemic has really shown us where gaps in our system exist. Millions of low-income children count on schools and after-school and summer programs to provide them with some or all of their meals. And when schools were abruptly shut down in March of 2020, immediately pivots had to be made to ensure that children would be able to access meals. This was done through waivers through the Department of Human Services, and it continued throughout the summer as summer programs remain closed. It continues now currently, even though children have gone back to school. For children who are remote or virtual, pandemic and summer EBT should be expanded to year-round when schools are closed as a complementary approach to the summer nutrition programs. This allows parents to receive the benefit on a debit card to purchase the food during the summer when the schools are closed. And many evaluations of the summer EBT and pandemic programs have shown that they help to significantly minimize food insecurity during the pandemic. One important aspect of this PBT program is that it allowed immigrant children to receive the benefit where they otherwise might not have been eligible. And that is all for my part. Next slide. I'm going to turn it over to my colleague, Tomiko Townley, who is going to talk to us about SNAP and the Farm Bill.
Thank you so much, Maricela. Can you hear me? Okay, cool. Lots of information, lots of great information. Thank you so much for sharing all of that. I just want to let you know that I was very excited about this panel and I wore my shoulder pads today. So just want you to know how important this is because I brought out the shoulder pads. So SNAP and the Farm Bill, super exciting, right? The last time, well, the 2018 Farm Bill was a pretty good representation of what we will likely endure during the next Farm Bill. So the Farm Bill is a huge piece of legislation that touches everything from the seed and growing the seed and harvesting crops and delivering food to the grocery stores and or markets and getting that food onto your plate. So seed to plate is the way that I think about the Farm Bill. It also attempts to address inequities in that system. And the three major pieces of the Farm Bill are around farmers, around people who are food insecure, and then also protecting the environment so that we can still have food that is safe to eat. But SNAP is the largest chunk of the Farm Bill. It takes up about 80% of the funding through the Farm Bill. And that 80% isn't going to just any random people, it's going directly to ensuring that benefits get to people. And most of that funding, I think it's like 97% of it does directly go into people's pockets. So all of us are a part of the agricultural system. All of us are impacted by the Farm Bill, whether we recognize it or not. It feels kind of like this invisible, huge legislative thing that happens every 5 years. But it is incredibly important for us to know that it is coming up, that we have an opportunity to like scream from the rooftops that SNAP is an important program, that we need to ensure that the funding is not only adequate, but is effective at addressing the needs of people who are food insecure. And one of the most fascinating things that's happened since the Farm Bill was introduced is that the majority of people who do qualify for SNAP now are in rural communities versus when the Farm Bill was first started, and they had to make compromises about making sure that people in urban areas were fed and had access to SNAP. So next slide, please. SNAP is the Supplemental Nutrition Assistance Program. What we know about SNAP is that the history of it was really not meant to address the needs of food insecure people. It was really started to address the surplus of foods that were cheap and hurting farmers. So the original food stamp program required people to purchase actual stamps. So there's some pictures there. If you bought one stamp for $1, the government would subsidize 50% of that so that you could buy some of these surplus foods, which would help the farming community. And the decline in crop prices really initiated that change in policy. So from the 1930s all throughout up until the 1980s, we saw pilot programs of the food stamp program in different communities. We saw studies about, what types of food families had access to and were eating. And then the program became permanent. And from the 1980s until now, we've seen a real shift in the way that SNAP is discussed and just thought about. I will say that during the Reagan administration, there were a whole lot of negative anti-poor rhetoric around SNAP participation. And at the time it was still food stamps, including things like welfare queen and all of those ugly words that were associated with people who were just trying to get access to healthy foods on a budget. We also have seen some positive things, including creating the electronic benefits transfer card, which does not require people to count out stamps and use them at the grocery store or wherever you purchase your food. So it makes it easier for the participant. It makes it easier for the retailer, and it also addresses one of the biggest issues and the most expensive issues that USDA was facing around fraud. So lots of good things to say about electronic benefits transfer. The other things that we've seen nationally around SNAP is this tie between food assistance and work, and that you must be working or show that you are exempt from working somehow in order to receive benefits, unless you are a child or somebody over 60. So those are just some of the major changes around the food stamp program, the SNAP program, that I just wanted to address. And let's see here. Can we go to the next slide, please? So Maricela did a really great job about talking about the barriers to accessing public benefits, not just WIC and school meals and all of the child nutrition programs, but SNAP is not exempt from the barriers that exist. If anything, we know that there's a lot of stigma around applying for benefits. We know that BIPOC people are disproportionately impacted by poverty, and they are also facing unfair treatment many times in DHS offices. So that's one big barrier: stigma and worry about being treated unfairly when you go to apply for a food assistance benefit. The other thing, especially in Arkansas and nationally, is we struggle with access to transportation. DHS offices, which there's at least one in every county in Arkansas, might be in the county seat, and the population does not all live in that county seat. So getting to and from the DHS office to turn in paperwork, to simply apply, to address an issue that might be withholding your benefits can be impossible if you have mobility challenges or lack of transportation. Not to mention that if you qualify for SNAP, you are living in poverty. So there are many other things that come along with living in poverty. You might have health issues. You might have challenges with housing. You might, especially after the pandemic, we saw many families that have merged so that they could save money. And sometimes that can cause some really tough dynamics in a family, because under SNAP, you are considered a household if you purchase and prepare your meals together. And when you purchase and prepare your meals together, they require you to submit income and expense information for that household. So that can be really tricky if you are living in a multifamily household. Also, many of the barriers that Maricela talked about are language barriers. Many of the applications, and the SNAP application in Arkansas now is 36 pages long, and there shockingly are not an ample amount of caseworkers in DHS offices that can help families apply for the program, answer questions about their eligibility, the paperwork that needs to be submitted. So if that's something that you're interested in, please reach out to me, because we are always looking for people to support families access SNAP. Not to mention just the mental health impacts of being a person living in poverty and potentially living in trauma. I will say that collectively, we probably can empathize with living in a traumatic time during a pandemic. the things that we recognize now have existed before the pandemic. People have been living in poverty and making it month to month and at risk of homelessness for a very long time, especially our BIPOC population. So this is just a slide about some of those barriers. The other thing, especially in Arkansas, is literacy challenges. Literacy and then also vision. We used to work with older adults and really trying to get older adults to apply for SNAP because they are the population who qualifies but does not participate in the program as much as we would like them to, and we know that they're eligible. And part of that is because the writing on the application is itty bitty and it's all written in jargon. So if you have any sort of literacy challenge, getting through a federal application is overwhelming, if not nearly impossible. One other thing I want to say about SNAP before we move on to the next slide is that SNAP is an entitlement program, which means that any person who qualifies based on their income, their citizenship status, their expenses, and their living situation qualifies for this program. There's no such thing as if I apply for benefits and I receive them, I'm taking them away from somebody else. There is enough money dedicated to the SNAP program federally to serve every single person that qualifies for it. So we hear that often, that I don't want to take it away from another person that needs it more than I do. When that happens, our participation rates go down. When our participation rates go down, many people in Congress look at that and say, oh, look, we don't need this program as much as we thought we did. Let's cut it. And that is what we've seen in some of the most recent farm bills. So every person that qualifies for the program, we want them to get the help that they need. And we are not talking about thousands and thousands of dollars for food. We are talking about a very, very modest benefit. Next slide, please. So this is a SNAP eligibility chart. You'll see that it's good through next month. This shows you that a family of 4 can really only make a gross income amount of almost $3,000. And they have to be spending, which we know they are, a pretty significant amount of that on housing and allowable expenses under SNAP. Also, it's not on this slide, but a family of 4 qualifies for anything. I mean, if they qualify for SNAP and they receive benefits, they can receive between $24 and $680. That $680 is the max, which means that you pretty much cannot have any income in order to receive that maximum benefit. So again, we're talking about a very modest benefit amount and one that many families rely on to cover the majority of their grocery expenses. And what we know is that many, many people run out of benefits before the end of the month. Usually within the first 2 weeks they receive their benefits, those benefits are gone. So during the pandemic, there was a 15% SNAP benefit increase, and that was under the COVID-19 relief bill. And then it was extended by the American Rescue Plan, which is likely or going to expire in October. But don't fret, because the USDA has reevaluated the Thrifty Food Plan, which is the basis for how you calculate how much benefits a family is eligible for and what the entire federal program bases benefit amounts on. And so we'll see a very small increase in this because they've updated that Thrifty Food Plan. Next slide, please. So SNAP's Thrifty Food Plan, good changes. Things are looking up. They're not looking great, but they're looking slightly better, which is always a good thing when we're talking about policy, because it can take so long and it's a marathon to get these programs to be what we want them to be. So in 1975, the Thrifty Food Plan was created. That was the the parameters of how we were going to identify what a family would be eligible for. The question that we've asked since 1975, every time we evaluate this, is it theoretically possible to purchase a nutritious diet on the existing thrifty food plan cost? Theoretically is not how many of us, well, any of us live our lives, right? And since 1975, every time that the thrifty food plan was assessed, we just increased the amounts of benefits based on inflation. So not taking into consideration the changes in work hours, the changes in the overall economy, the changes in cost of living. It is really was based on the inflation rate. So next slide, please. So in the past, the thrifty food plan did not reflect the foods that most people consume, and often just thought that, took into consideration that people just had all day to cook. So they were talking in theory there, like if we gave them bulk rice or bulk beans, how long would it take a family to prepare a meal? It would take hours and hours and hours. It did not meet the federal nutrition recommendations, so people were not able to get the nutritious items or afford the nutritious items that they needed for their diet. And it didn't account for any of the dietary restrictions or the cultural dietary needs that households who qualify for SNAP have. So during the reevaluation of the thrifty food plan, the new question is, how much does a modern and healthy diet with foods that most people eat and working families have time to prepare really cost? Which is a more representative question that has ended up with a slight increase in the thrifty food plan. Next slide, please. So these changes are massive in the SNAP advocate world, because we're talking about an additional $1 and some change per person per day. So from $4.25 per person per day, which I know I cannot live on $4.25 for me for a day. It's gone up to $5.45 per person per day. It's a meaningful, modest increase that addresses many common issues that families face, including running out of benefits before the end of the month. So this change will result in about 2.4 million people, which include over 1 million kids, being lifted out of the poverty line, above the poverty line. And it supports children's health and improves food security overall nationally. So listening to some of the people who have worked on this for decades, getting misty about this $1 and a little bit of change increase for SNAP benefits is really huge, and makes a big difference, because it really does change the types of food that families can bring into the home and eat. And that change will happen in October. So we will have a new basis of issuance chart that will reflect the thrifty food plan changes. And I think we need to move on to questions. So
Tamika, can I just add one thing to that, which you may have mentioned, but on the thrifty food plan, those numbers on the previous slide reflect the program when it's not with extra pandemic benefits. And so if you know families who are on SNAP, they will see an increase this fall, but when the supplemental pandemic benefits end, when the public health emergency ends, we don't know exactly when that will be. Hopefully soon for our health, but when we see those pandemic supplemental benefits, and so we'll see that they may see their SNAP benefits go up for a few months and then they might go down a little bit, but that 425 and 545 that you saw in the previous slide reflect, those are non-pandemic numbers. And so that 545 will be the average after the public health emergency. It'll probably be confusing for folks who have SNAP, because they'll see their benefits go up and then they'll see them go down, and they might not be aware that the public health emergency was the reason for that. But so keep that in mind if you work directly with people who have SNAP benefits, that they should be expecting that in the coming months. Thanks.
And unfortunately, they've seen some of that already with the emergency allotments. Just to add more complication to this conversation, any family when we were, under the state of emergency and our state was applying for emergency allotments for families, any family that was not currently receiving the maximum benefit for their household was able to get bumped up to that emergency amount, which is the maximum benefit amount. So when that went away over the summer, people were shocked about the lower amount of their benefits. And then again, like Laura mentioned, we're going to see some changes here. So explaining that can be complicated, but you've got great people here at Arkansas Advocates, and I will do my best to try to explain if you're working with people and they don't understand why their benefits have changed. Thank you, Laura.
So if you have any questions, you can put them in the chat, or you can unmute yourself as well. We do have one question in the chat that I think is for you, Tomiko. Does the Farm Bill include farmers to families?
I don't know.
Maricela looks like she knows.
Okay,
Yes.
good. Maricela, you answer.
So the Farmers to Families program, we saw here in Arkansas during the pandemic a huge increase in the number of places that received it. Those are the food boxes that are full of, fresh vegetables. They have meat products and also milk and dairy products in them, and that program is part of the Farm Bill. But generally speaking, pre-pandemic, that's a much smaller program than what we saw during last year.
Thank you.
And thank you, Marcelo. We have another question. What is the amount of cash or property that I'm able to own or have to be eligible for SNAP?
Laura, do you want to take this one?
Yeah, thank you. Arkansas has the strictest asset limit in the nation. We're one of only 10 states that makes it more difficult for families to keep SNAP benefits based on their assets. And the limit is it's about money. Your cash assets, your home doesn't count, your car doesn't count. But it's $2,250 for most families, and then is it $3,500? It's about $1,000 or more over for families who have someone who's 60 years older or who has a disability. And that's a choice that we're making at the state level to set it that low. If it had kept up with inflation when it was first implemented in the 70s, it would be closer to $9,000 now for that. And we have been making the argument for years that we needed to lift that, at least raise it, if not eliminate it. Most states have eliminated it altogether, but we need, and they still have the eligibility limits that you saw on Tomiko's slide earlier, but the asset limit is separate from that. But our argument is, families who are working to lift themselves out of poverty need to have emergency funds. They need to have some savings and ability to be able to keep their nutritional supplemental benefits coming in. At the same time, they're able to build some savings. And so, yeah, the asset limit is too low in Arkansas. And if there's any policy issue that you want to join, then join us on that. And there is some hope. We've tried at the state level to fix it, and it hasn't worked. But as the Farm Bill is renegotiated over the next couple years, it could be that we could make the argument that asset limit should be removed, since most states have already done that, and it would benefit Arkansans almost more than any other residents of the United States.
And someone's hands raised, and we'll get to you in just a second, but while we're still on the asset limits, someone had a follow-up question. I think you answered most of it, but why was this decision to make such strict asset limits made for other programs, or was it just SNAP?
We have, yeah, it also applies to other programs as well. And we made them stricter than they need to do. Those vary, but in general, in Arkansas, we have put more restrictions on low-income families than federal law requires. And for a state that has a very high poverty rate, it doesn't make any sense at all.
And just one more thing about asset limits, because it does include other assets outside of just cash. So that's a big challenge for some of the families that we've worked with in more rural communities, because many times families pass land to their family members. And if you own land that you are not currently living on, and that land is generating some sort of income, that could prohibit you from receiving SNAP benefits. So that's a big problem. One misconception that people have is that you are not allowed to have a car. You are totally allowed to have a car. You are totally allowed to own a home if you qualify based on the other income and expense qualifications.
Thank you, Tommy. So we have someone's hand raised, and I apologize if I say your name incorrectly. Nastasia.
Hi, yes, it's Nastasia, but thank you. I try to take my video, so I don't know if you can see me or not because I'm on my phone. But my first question was, can people be ineligible for SNAP benefits if they've been to prison or have a federal crime? I didn't know if that was a thing or not.
So that rule was repealed in 2017 in Arkansas. So the law from 1997, I believe, until 2017 was that if you had a felony conviction for manufacture or distribution of drugs after 1997, you were ineligible for life from SNAP. Now that rule is gone. So any person with any felony conviction that qualifies based on income and expenses and asset limits and all of those other things does qualify.
Oh, nice. Okay, my second question was about the school programs. I remember the statistic was like 7% of children aren't going to like the after school lunches, and it was because there wasn't enough programs. I was wondering if there was like, I mean, obviously you guys have looked at the data for that, but if there were like data of like people trying to get school lunches, or if they're just not able to like get to the certain programs.
So there's a couple issues that apply to that. So transportation certainly is one. We have seen over the past 10 years a decrease in the number of programs that provide transportation to their centers. And so children whose parents work outside the regular center hours are not able to take their children to the program because they're not able to drop them off somewhere before they need to be at work. Another issue is that the child may be located in for example, the schools may have summer feeding programs, and they may be located in that school's area, but they don't have transportation because the school buses aren't running during summer. One interesting program that I think is interesting to look at as a pilot for how we might address transportation issues is the local Be Mighty program, which is through CALS, the library system. So they provide bus passes for anybody under 18 to be able to get to the local libraries that has summer and after school meals. And they are able to go and eat their meal there. One of the things CALS has suggested is that the waivers that allowed people to pick up the food made it much easier for people to come by when it was accessible to them, because many times the programs are restricted hours and currently require that they eat the meal on site. If you allow them to take the meal and eat it when they want, that allows much more flexibility for those families.
And thank you, Maricela. We have another question that is about farmers and families. Is that the same as the commodities?
No, so commodities refers to the certain types of crops that are eligible, that farmers are planting, that are eligible for them to receive reimbursements or assistance. And so in between 2014 and 2018, that was generally corn, wheat, soybeans, peanuts, cotton, and rice, as roughly 92% of the commodity payments. So commodities refers to the payments to the farmers for the crops that they're planting. The farm to table program actually refers, those are food boxes that are, as I said, they have fresh fruit, fresh vegetables, they have dairy products, and generally it includes gallons of milk, and they will have a meat product. Typically the one thing that is not in there is a like bread or something of that nature, but pretty much everything else are covered in those food boxes. So commodities refers to payments farmers are receiving through the Farm Bill, and the farm to table program is really sort of an extension of what the original idea was behind the food stamp program. It's a way to get farmers to be able to sell their product through the government directly to the people who need services.
Thank you. Maria, do you want to unmute yourself?
So I don't know if mine is a question or is a comment. I mean, all this is a really great information that you are providing. It's really good for the families who really needs it. But I was just thinking, how do these programs control that the people are really saying the truth about their income? Because I know some families that they apply for these programs, but they put as a single mom, but in the reality, they have their partners living, but they're not reporting the incomes. And at the same time, I see other families, like couples that they try to do things right, they marry, and then try to have work and have everything that they need, but at the same time, they don't qualify for these programs because they're trying to do things right. So basically, it's like these programs are telling. Even one time I hear this person saying, I'm not gonna get married because if not, I'm not gonna qualify for anything. So it was like, for me, it's a little frustrating seeing this stuff and seeing, like I say, seeing couples that they just married, they had a baby, but the baby don't qualify for, I mean, the mom didn't even qualify for Medicaid on their pregnancy. They had to have bills. They have the insurance, but it's hard to pay bills because insurance does not cover for everything, and the child does not qualify for WIC. The mom didn't qualify for WIC because she was pregnant. I mean, I saw a couple couples that they on this situation, and it's a little kind of for me it's a little frustrating just to see these situations that other people take advantage of these programs. I mean, I'm okay when you really need it, but sometimes it's just like, how do you handle this?
Thank you for bringing that up, Maria. Like any program, there will be a handful of people who are bad actors and might misrepresent their actual income. The majority, like the vast majority of SNAP participants are doing everything right and are not misrepresenting their financial situation. We also know that SNAP is the toughest program on fraud. So when you ask how are we sure about the information that people are submitting, it's pretty rigorous in order to qualify for benefits. You have to submit your most recent pay stubs if you're working. You have to submit copies of bank account statements if you are a person that has a bank account. You have to, prove that you qualify for these programs. And I hear what you're saying about people who absolutely need the support, and for whatever reason that is not communicated effectively to them, they don't qualify. And they fall between the cracks. And I think that part of this conversation has to be about, we are talking about federal advocacy, but the advocacy at the ground level is so important. And it is every person's right to ask, can you show me the policy that says that I don't qualify for this program? Can you show me the reasons and explain it to me in the language that I speak, or in words that I can understand that are not DHS jargon, why I don't qualify for this program? And it is every person's right to apply, every single person's right. Even if they know that they may not qualify, they have the right to apply for the program and either get approved or denied. So while I hear your frustration and I share your frustration, I do want to just say that the majority of the people who are recipients of SNAP benefits absolutely need food assistance and have a hard time even getting those benefits and continuing to receive them when they do need them because of the requirements that the state puts on information collection. So if you know of specific instances, if you want to talk about this further, I'm more than happy to put my cell number in the chat. I think that it just requires us to kind of take on some of that responsibility as people who are working directly with families that qualify for SNAP and addressing those needs on a case-by-case basis rather than generalizing about the population. But I hear you, and thank you for bringing it up.
Yeah, that would be great if I can get your information, because I've been telling some of these families, apply for this program, and they say, I don't even qualify because I make a little more money than that, but they're paying for their houses, they're paying for their cars, they're trying to pay for childcare, but it's allowed when you put your child in a private childcare, it's a lot of money. So they're just trying to find a different way to how or where to take their kids while they're working. So it's not enough money to pay for a private childcare, but it's a little more money for that they don't qualify for the early intervention programs.
Thank you.
Thank you.
So we have a couple more questions, and then we're going to take a quick break. One is kind of a two-part question. Basically, that there are a lot of people who are living paycheck to paycheck and can really benefit from SNAP, but they don't qualify because they're right above the qualifications. Is the state of Arkansas looking at ever lifting the very low limits for additional assistance to these median households? And then as part of that, they said, for instance, a family can qualify for our kids and WIC, but not SNAP. Why isn't the program within the same income assistance level?
So I'll start off, and then I guess, Tommy, you can jump in. Arkansas doesn't choose at this time to raise the income level. They've had the opportunity every session to do that. That has been something that has been raised. But the important part of this is that this is based on the federal poverty level. And we know that the federal poverty level does not represent the actual levels of poverty across the United States. It's not indexed by state. It doesn't represent the amounts that you have to pay if you live in a city versus a rural area. And there's advocacy that can be done around this issue. The number one reason that this hasn't changed significantly is because if they increase the poverty level, that would increase the number of poor people, or the number of people who are designated as poor in the country. And that's really not a good reason not to reassess the way that they have determined what is the poverty level. So while there's always a hope, because Arkansas does have the ability to increase the limits, certainly if we increase the federal poverty limits themselves, that would also assist people.
Thanks. So our last question before we take a break and come back and talk about how to actually advocate at the federal level for these policies that we just talked about. Are college students who are full-time eligible to receive SNAP if they're only attending school and not working?
Oof, that's a tough one. Students have some of the weirdest restrictions on accessing SNAP. So I would have to know a few more things in order to be able to give you an answer. I'd be happy to email you, like we have a cheat sheet of who qualifies for SNAP and like a student eligibility cheat sheet. But it can be really tricky if you're a full-time student and you are not doing work study, you don't have a child under 6, you don't, have all of these other requirements that make you eligible for SNAP. But it is so individual that I'm hesitant to give a general answer about students and SNAP. So in theory, yes, a full-time student should qualify for SNAP if they meet all of the other qualifications. But it can be very challenging for that student depending on their class schedule, depending on assistance that they might be receiving, financial aid or family support, because of the restrictions around student access to SNAP. So I'm sorry, that's not an answer that you were probably looking for, but I'd be happy to talk to you out of this conversation if you've got somebody specific in your mind.
Okay, thank you all so much for those questions. We're going to take, actually, if y'all will allow, instead of a 10-minute break, since we had so many great questions, if we take a 5-minute break and come back, and we'll talk about the federal legislative process and then tips for how you can advocate for the Child Nutrition Reauthorization Act and the Farm Bill when we come back. So if y'all want to go, we'll come back at about 2:16. So thank y'all. See you in just a minute.